Symptoms of pregnancy. What happens first? Symptoms of pregnancy are the unusual signs and feelings that show a woman is pregnant. Every pregnant woman is different, and the pregnancy signs differ from one woman to another, but seem to be universal from stage to stage, accounting for about 40 weeks or 9 months. Some will sail through pregnancy with very few symptoms, and others will be dogged with multiple discomforts throughout the 9 months. It seems tough to hear, but that is the sweetest moment in a woman's life as well. Welcome back to my YouTube channel, Mama's World. I'm back with another informative video for those who want to know about pregnancy symptoms and waiting to feel them. In today's video, I'll be sharing about pregnancy symptoms. So stay with me until the end of the video. Do remember to subscribe to my channel if you're new, and smash that bell icon to remain updated with all my upcoming content. Without much delay, let us start the exciting video. There are lots of ways to manage any symptoms that arise, and no matter what the discomfort, at the very least, you know with certainty that it is temporary. The most identifiable pregnancy discomfort symptoms are usually experienced during the first trimester. Some of this early pregnancy can show up before you even miss your period. The most common early signs and symptoms of pregnancy might include missed period. Pregnancy timing is measured using gestational age. Gestational age starts on the first day of your late menstrual period, LMP. If you're in your childbearing years and a week or more has passed without the start of an expected menstrual cycle, you might be pregnant. However, this symptom can be misleading if you have an irregular menstrual cycle. Tender, swollen breasts. Early in pregnancy, hormonal changes might make your breasts sensitive and sore. The discomfort will likely decrease after a few weeks as your body adjusts to hormonal changes. During pregnancy, breasts become fuller, swollen, and tender. These changes are similar to those you may have noticed a few days before your period. During pregnancy, the skin around the nipple becomes darker and the veins in the breast become more obvious. This might be uncomfortable, but the sweetest thought of having a little baby may reduce this discomfort. Nausea with or without vomiting. The majority of women experience nausea and vomiting during or around the 4th or 6th week, and the pregnant woman loses appetite and always experiences pain in the morning time. Morning sickness, which can occur at any time of the day or night, often begins 1 or 2 months after you become pregnant. However, some women feel nausea earlier and some never experience it. While the cause of nausea during pregnancy isn't clear, pregnancy hormones likely play a role. Increased urination. You might find yourself urinating more often than usual. The amount of blood in your body increases during pregnancy, causing your kidneys to process extra fluid that ends up in your bladder. Pregnancy causes an increase in levels of body fluids and greater kidney efficiency. The swelling uterus also presses against the bladder. As a result, most women start experiencing more frequent urination within the first few weeks of becoming pregnant. Fatigue. Overwhelming tiredness is common in early pregnancy. This is most likely caused by the massive increase in the sex hormone progesterone. Progesterone is needed to maintain the pregnancy and help the baby to grow, but it also slows your metabolism. Fatigue also ranks high among early symptoms of pregnancy. No one knows for certain what causes sleepiness during the first trimester of pregnancy. However, a rapid rise in levels of the hormone progesterone during early pregnancy might contribute to fatigue. Other less obvious signs and symptoms of pregnancy that you might experience during the first trimester include moodiness. Some newly pregnant women experience mood changes such as irritability. Other pregnant women experience feelings of elation. It is thought that pregnant hormones influence chemicals in the brain, causing mood changes. During pregnancy, 1 in 10 women experiences depression. Depression is treatable, so if you're feeling depressed or down during pregnancy, it is extremely important to get help early. The flood of hormones in your body in early pregnancy can make you unusually emotional and weepy. Mood swings are also common. Bloating. Having trouble buttoning your jeans? Early pregnancy bloating is hard to distinguish from period bloat. but it's an early pregnancy symptom that many women feel soon after they conceive. Hormonal changes during early pregnancy can cause you to feel bloated, similar to how you might feel at the start of a menstrual period. Unfortunately, bloating is often accompanied by constipation. Getting the right amount of fiber in your diet can help keep you regular. Light spotting. Light spotting might be one of the first signs of pregnancy. Known as implantation bleeding, it happens when the fertilized egg attaches to the lining of the uterus, about 10 to 14 days after conception. Implantation bleeding occurs around the time you would expect to have a menstrual period. However, not all women have it. Implantation bleeding is usually medium pink or light brown. It's rarely period red. It's also spotty, much lighter than a period, and not continuous, lasting a few hours to a few days. Cramping. Some women experience mild uterine cramping early in pregnancy. Leg cramps occur due to a buildup of acids that cause involuntary contractions of the affected muscles. They're experienced by up to half of the pregnant women, usually at night. Leg cramps are more likely in the second and third trimesters. Food aversions. Your extra sensitive nose may be responsible for another early sign of pregnancy. Food aversion, where the thought, sight, or smell of certain foods you normally like can turn your stomach. When you're pregnant, you might become more sensitive to certain odors, and your sense of taste might also change. Like most other symptoms of pregnancy, these food preferences can be chalked up to hormonal changes. Blame those hormones again, especially early on when your body is flooded with them and still getting used to all the hormone changes. Do not worry. This early symptom often passes by the second trimester, when you have settled down there. Nasal congestion. Increasing hormone levels and blood production can cause the mucous membranes in your nose to swell, dry out, and bleed easily. This might cause you to have a stuffy or runny nose. Increased blood flow to the nasal passages and enlargement of the nasal veins also play a role. It lasts for at least 6 weeks and is not linked with infection or allergies. It tends to get worse later on in pregnancy, and it goes away on its own within 2 weeks of delivery. Are you really pregnant? Many of these signs and symptoms aren't unique to pregnancy. Some can indicate that you're getting sick or that your period is about to start. Likewise, you can be pregnant without experiencing many of these symptoms. Still, if you miss a period and notice some of the above signs or symptoms, take a home pregnancy test or see your healthcare provider. If your home pregnancy test is positive, make an appointment with your healthcare provider. The sooner your pregnancy is confirmed, the sooner you can begin parental care. If you're planning to conceive or just learned you're pregnant, start taking a daily parental vitamin. Parental vitamins typically contain important vitamins and minerals such as folic acid and iron to support your baby's growth and development. That's all for today's video. We'll be back with another video on Mama's World. Until then, take good care of yourself and like and share the video. Share your pregnancy experience with us and let us know your views about the video in the comment section below. Thank you.